Welcome to this new session of elements of patient abandonment under doctor-patient relationship. Today we are going to majorly look at one of the components of doctor-patient relationship, and that is patient abandonment. We've looked at doctor-patient relationship in details in other videos. If you've not watched this video, then you can check the playlist. It has the rest of the videos about doctor-patient relationship. It has how to start doctor-patient relationship, characteristics of a good doctor-patient relationship, how to terminate doctor-patient relationship, the process of termination of doctor-patient relationship, and then we've talked of the importance of doctor-patient relationship. Just a recap: doctor-patient relationship, ideally, it's, in layman's language, it's a relationship between a doctor and a patient. But when we go into details, realize that a doctor-patient relationship, it's a complex relationship. That's a complex relationship between a doctor and a patient, and it's always formed when a doctor tends to a patient medical needs. Just a recap, we've already done doctor-patient relationship in most of the previous videos, so if you've not checked, you can check in the playlist of doctor-patient relationship, or you can check in the playlist of medical ethics, human rights, and professionalism. So when does doctor-patient relationship start? Doctor-patient relationship, abbreviated as DPR, it starts once the doctor or the physician or the health worker accepts to take care of the patient, or agrees to take care of the patient. Once the doctor starts to see the patient, then we say, or we declare, that a doctor-patient relationship has started. So it has aspects. Starting it is one of the aspects, maintaining it is another aspect, and terminating it is another aspect. I've told you in some of our videos below, we've talked about how to start a doctor-patient relationship. We've talked about how to maintain doctor-patient relationship. We've talked about the characteristics of a good doctor-patient relationship, and we've talked about the process of terminating doctor-patient relationship. Now this is our fifth component, which is patient abandonment. So today we are going to look at patient abandonment. When do we declare that the doctor has abandoned the patient? Patient abandonment is different from termination of DPR. Patient abandonment, as we are going to look at it here in details. So at the end of today's session, you must be able to capture the four elements of patient abandonment. You need to know the definition of patient abandonment, the elements of patient abandonment, and when do they occur, and when does patient abandonment occur. The definition of patient abandonment, just a recap. Patient abandonment, it's a form of malpractice. As you're going to see, that there are four elements, that once those four elements the four elements are not reached, then we can declare that there has been truly patient abandonment. The patient has been abandoned by the doctor. So patient abandonment itself is a form of malpractice, and the patient abandonment, this malpractice occurs when the doctor or the health worker decides to terminate the doctor-patient relationship without reasonable notice or reasonable excuse. If you recall, in one of the videos of how to terminate doctor-patient relationship, it has also elements, it has aspects, it has the key components in the process of terminating doctor-patient relationship. Now once you terminate it, without reasonable notice. And you realize that reasonable notice is one of the steps in the termination of doctor-patient relationship process. So patient abandonment, it's a form of malpractice that occurs when a physician terminates the doctor-patient relationship without reasonable notice or reasonable excuse. And to make matters worse, that the doctor fails to provide the patient with opportunity to find a qualified replacement care provider. These three aspects I've spoken about are one of the components of, actually they are among the components of doctor-patient relationship termination process. I've told you the definition of doctor-patient relationship. One thing you need to know is that it's a form of malpractice. Uh, this malpractice occurs when the physician terminates the doctor-patient relationship without reasonable notice to the patient, reasonable excuse, and he fails to provide the patient with an opportunity to find a qualified replacement care provider. So these are the four common elements of patient abandonment in a doctor-patient relationship. I've been trying to give you a recap on doctor-patient relationship. I've told you the definition of doctor-patient relationship, DPR. We've looked at patient abandonment, the definition. Now we are going to look at the four core elements of patient abandonment, the four common elements of patient abandonment in the doctor-patient relationship. So for a doctor to be charged with a case of patient abandonment, the following elements must be true. Actually, some of those elements are the ones that have been the definition of patient abandonment. A recap with emphasis: patient abandonment, it's a form of malpractice. That's number one. To it occurs when the physician terminates the DPR without a reasonable notice or reasonable excuse, and the doctor fails to provide the patient with opportunity to find a qualified replacement care provider. So let us look at our first element. The first element, number one, there must be an ongoing doctor-patient relationship. For us to start looking at whether there has been patient abandonment, the first thing to be in place is that there must be an ongoing doctor-patient relationship. We've looked at DPR, doctor-patient relationship. So the second component, um, element number two, is there must be need of care by the patient at that particular time. The abandonment must take place when the patient is still in need of medical attention from the doctor. Then the third component, third element number three is abrupt termination. The abandonment must have taken place so abruptly that the patient did not have enough time or resources to find a suitable replacement physician or doctor or health care or health worker to take up. So this can range sometimes to 2 to 3 weeks. That's when, if the patient, him or herself, is looking out for another qualified health worker take care of him or her. But it can be as early as possible, so long as the doctor or the healthcare worker or the provider hands over the patient to another qualified provider or attendant. So we've said abrupt termination, that the abandonment must have taken place so abruptly and that the patient did not have enough time to look for. Then finally, our fourth element is injury to the patient, that your act of abandoning the patient must have caused injury to the patient. The patient must have suffered an injury as a direct result of the patient abandonment. Thank you so much. Um, Thank you so much for watching this video up to the end. I request you to subscribe. Click on the subscription button below to get notification of the other videos if you missed out some of the videos in the medical ethics, human rights, and professionalism. Just a recap, there are five components of the valid doctor-patient relationship termination process. Just a recap: the physician should provide the patient with a written notice of termination, and the reason of termination should be included in the termination notice. Another component is the physician should continue to treat the patient for a reasonable period of time to allow the patient to arrange alternative care from another worker. And we also, I'm recapping for those who have not watched the other videos. The physician should also recommend another qualified physician. And when you look at what I'm talking about, these are the things which have contributed to the four elements of patient abandonment. That once they go awry, once they are not provided well, then it becomes patient abandonment. Once they are done well, then it becomes a valid doctor-patient relationship termination. The physician should also recommend another qualified physician. Then finally, once the patient has secured another doctor or healthcare worker or physician and he has signed authorization, then the physician must transfer the patient to patient's records to a new physician. Then we can call it a valid doctor-patient relationship termination. Alternatively, the patient herself, him or herself, can choose to terminate the relationship, and the patient can choose to terminate at any one time. Be like, doctor, no, today, or our relationship has ended today. It can also be implied that the patient may not come back for treatment, so that's like the patient has terminated the relationship. But for a doctor, is not allowed to do that. It's supposed to follow the steps. In case those steps are not followed, then it becomes patient abandonment. Thank you so much. You can watch the next video. If you've not watched, you can watch our next video. Video about the valid reasons to end a doctor-patient relationship. There are quite a number of reasons as to why the doctor may choose to end the DPR, doctor-patient relationship. Thank you so much.